Really common questions we get in consultation, especially with patients that are interested with breast augmentation and they may not be thinking about breast lift, or patients that just come in and ask, do I need a breast lift? And the first thing I like to ask patients about that is, do you like your breast? Because we have a bunch of textbook answers about what an ideal breast may look like, and that's frankly a little bit different for everyone. So plastic surgeons have our standards that we look at, but if you're happy with the shape of your breast, no one needs a breast lift. So that's really the starting point with where we want to begin the discussion. And then going from there, we have different criteria that we're looking at to offer you a breast lift. So are you happy with the shape of your breast already? If not, then we're gonna talk about what we can do for you. And a breast lift may be one of the tools in our toolbox to help you achieve your goal. So if your goal is to get a more youthful appearance of your shape and reposition the nipple into a more ideal position, a breast lift is what you're looking for. Also, if you have asymmetry between your two breasts, a breast lift is really one of the main things we can do to achieve better symmetry between both sides. And then finally, we have to think about what your goal is. If you've had children, if you've lost a lot of volume in your breast, if your goal is to not only reshape the breast, but retain or build up the upper pole volume, you're probably gonna need an augmentation as well. And that's one of the times when I will recommend or I'll require that you need to get a breast lift if you wanna do an augmentation and you have a certain degree of sagging or ptosis. So getting into that, how do plastic surgeons quantify sagginess of your breast? We call it breast ptosis. And so basically this is all dependent on the relationship of your breast tissue and your nipple to the fold of your breast. So if you see, we'll say quote unquote normal because everyone's a little bit different, but the textbook answer of what a normal breast is both the nipple and the majority of the breast tissue is up above the fold of the breast. And then we have grades of ptosis, and these are our grades of sagginess. So grade 1 ptosis is where the nipple is at the level of the fold. Grade 2 is where the nipple is below the fold but not pointing all the way down. And then grade 3 is when the nipple is below the fold and basically staring at the floor. So that's the most extreme level of sagginess or droopiness. Then we have something else called pseudotosis, where the nipple is positioned up above the fold of the breast, but there's a lot of breast tissue, glandular breast tissue that's below the fold. And so what can we do with these different things? If you're a grade 1 ptosis and it's mild sagging, you really don't need to do anything, but if you want that upper pole fullness and you want an augmentation, it's possible that we can do just a breast augmentation without needing to do a lift for grade 1 ptosis, okay? For grade 2 and grade 3, it's basically required that we're gonna need to do a lift in addition to the augmentation, because if we don't, I'll show you a slide at the end where you get a waterfall or a Snoopy nose deformity where the breast tissue is basically falling off of the implant, and that looks really unnatural, and that's one time when I'll require that you really need a lift if you're wanting to do an augmentation and you have either the grade 2 or the grade 3 ptosis. So, again, this is one of those things that's kind of easy to say on paper, but might be difficult for you to think about when you're at home before you have the consultation. Now, obviously, when we have a consultation, we go through all this in depth, but if you're just trying to get a sense of what you think you might need, there's some things we can do that you can do at home to kind of see if you need to do something. One of the classic things people used to tell, patients is if you can put a pencil underneath your breast, that might mean that you need a lift. And that really doesn't hold true for everyone. So we have two different tests here. We have the pencil test, where if you put a pencil underneath the fold of the breast and it's very perky like this without any overhanging breast tissue, you're not gonna obviously need any type of a lift. But on a patient like this, your breast may be able to hold a pencil underneath it, but the thing that you want to look at then is the relationship of the nipple to the fold. If you pinch your breast and pinching it at the level of the fold and then pinching straight on, if your nipple is above where your index finger is pinching, then your nipple is in a good position and you probably don't need a lift, and we can do an augmentation by itself. But if your breast is like this, where you go to pinch your breast by checking how the relationship of the nipple to the fold, it's going to fail that test and you'll probably require a lift. And so when's the lift really necessary? Again, if your goal is to have the augmentation and you have that grade 2 or that grade 3 ptosis, and patients ask me all the time, they're like, can't you just do the augmentation? And that's when I say no, because you're not gonna be happy with me, because you're gonna get what's called a Snoopy nose deformity or a waterfall deformity. And that's where you can see the breast implant is gonna stay up high on your chest, and then all that saggy breast tissue is gonna be hanging off and your nipple's gonna be pointing down, and you're gonna be really unhappy with your results. That's a time when you absolutely need a lift if you're gonna be doing the augmentation and the lift. In another Thursday Thoughts, we'll get into the different types of breast augmentation techniques that we have and the placement of the implant to help mitigate some of these issues with needing a lift or not needing a lift at the same time as a breast augmentation.
Well, this is the question. Is just that when is required breast implant?
When is a breast implant required?
Yeah, lift with breast implant.
So if your goal is to get that upper pole fullness and get that really cleavage up high, you'll need something. You'll need an implant, you'll need fat grafting, but the most reliable thing is an implant with a lift at the same time if that's really your goal. If your goal is just to reduce the sagging and bring the breast back up into, the position they were when you were a teenager, then a lift alone may be doing the trick, but a lot of our patients end up wanting the augmentation and lift at the same time.
Okay, we have another question.
All right.
What kind of implants do you recommend?
So, by and large, my practice is always silicone implants, and there's a few different silicone implants that we can use. So there's saline and silicone. Saline is kind of an older school implant that most plastic surgeons don't use as much. It doesn't look quite as natural, has more prone to rippling that you can see through the skin, and so the highly cohesive silicone gel implants are what I recommend, and smooth and round. A few years ago we were placing textured shaped implants in, and they were helpful with maintaining a very natural appearance and shape with the breast, but there's been a very low incidence of a type of lymphoma associated with those textured implants. So most surgeons in the US do not use textured implants at all, and I for sure do not ever use textured implants at this point. All right, any other questions? For the month of October, we're gonna be doing all breast related content for our Thursday Thoughts. So if you have any specific topics you would like to cover, feel free to send me a message and we'll try and set that up for you.
And last but not least, remember that you have a new account and technical problems just one more time.
New account, it's Dr. Garret Wegerif, no dots, no spaces. My spelling is Garrett, last name is Wegerif, Wegerif. Thank you, everybody. Have a great day.